Hello, my name is Associate Professor David Szmulewicz and I'm a neurologist with specific interests in acquired brain injuries, spinal disease, peripheral nerve disease, and balance disorders. So to explain that a little bit further, it's my job to understand what a person has experienced following, for example, an injury, and to then distill the facts into what is hopefully a useful answer for the referrer and the patient. So this means understanding where the likely problem is, be it in part of the brain, part of the spine, a given nerve, or in part of the balance apparatus. So I became particularly interested in neurology because it's a very broad area that's somewhat complex and is also evolving because there is still much that we don't understand about the brain and we continue to learn. My interest in clinical research means that I very much enjoy keeping up with the facts and also hopefully contributing through my own work to our ongoing understanding of neurology. So I see a broad range of people, which include manual workers, such as those working with heavy equipment in factories or out on construction sites, all the way through to professionals, such as doctors who are heads of department and legal partners. The range of injuries I see, therefore, are very broad and may include damage to a peripheral nerve, such as may be encountered in a factory accident, all the way through to an adverse medical outcome, such as a response to a medicine or to a procedure. Given the broad range of people I see from many industries, the enjoyment in part for me is again in the variety, because I don't like being bored and I enjoy variety. And so seeing people who have injuries affecting, for example, their brain versus a peripheral nerve is a very different exercise for me in the way that I have to think about it and structure my response in order to help the referrer as well as the patient. So some of the ways in which I attempt to help the referrers are: one, to try and clarify the injury, being that the mechanism of injury, so how the person was actually hurt, to better understand what the patient themselves is experiencing, what they report, and then to look at the objective findings, which include, where appropriate, my physical examination of the patient, but also the tests that are done, such as the brain imaging or the nerve conduction tests, as two examples. The next step then is to analyze all this information, to distill it into a digestible form for a non-medico, such that the referrer may have dependable information that they can base their information on, and the patient hopefully has a greater sense of clarity and perhaps suggestions based on the report that I return to the referrer. I really hope that the injured people I see feel heard in the first instance, because they've often been on a significant diagnostic or medical odyssey, seen very many clinicians, and feel somewhat lost as to what the nature of their injury is and what to expect. So where appropriate, I try and clarify facts, but perhaps more importantly, I indicate to them that I will make suggestions and return that to the referrer. So overall, it's my hope that I provide a sense of expertise in giving some definite answers to the questions being asked by the referrer, such that the referrer can base their decisions on any further actions on dependable fact. And this may include the legal steps they take. It may include referrals onto other appropriate medico-legal assessments. as well as suggestions for added management.